The Ontario Premier joins us now, and thank you very much for giving us some of your time this afternoon. So let me ask you about this task force and why Rick Hillier in particular.
Well, we need someone that understands logistics, and there's no better person that I could think of than General Hillier. He led the NATO forces in Afghanistan. He was there when we had the ice storm in '98. Had 15,000 of his troops across the country, and we need an expert, and we need military precision when it comes to this distribution and logistics. It's going to be the largest distribution, the most important distribution we've seen in generations.
So, Premier, I am curious, just because when you started to think about all of this, and as you mentioned, the logistical challenge, you likely had a number of people, names potentially on the list that may or may not have had medical knowledge or background. So tell me about your decision to go with him and maybe a little bit, and I think you mentioned in your news conference it was a phone call, what his reaction was when you first asked him.
Well, on top of General Hillier, he'll be heading this up, but we'll have the top scientists, we'll have the top health professionals. And I sat back, and we've been working on this for months, and I thought we need military precision. The first person that came to my mind was General Hillier, and I gave him a call, and he said he'd give me a call the following day. He did give us a call the following day and said he'd accept. So we're very, very grateful to have someone with the expertise that General Hillier has, and I have all the confidence in the world. We're going to get this distributed right across our province.
And people are understandably very anxious about this vaccine rollout. And we had some good news, as you know, this morning, hearing about AstraZeneca, so a third vaccine now in the works. Tell me about how this is going to work. And obviously, this is going to be the work of the task force, but the priority of who gets it. And realistically, outside the provinces vulnerable, for the average person, are they looking well into potentially the summer or beyond?
Well, we'll have a better idea when we get the exact date off the federal government. I messaged the Deputy Prime Minister this morning to get the exact date. From that date, we're going to work backwards. But the priorities are going to be the most vulnerable. Long-term care, frontline healthcare workers, emergency service folks. That's how we're going to prioritize the vaccine when it comes in. For planning purposes, the federal government said they have approximately 2.4 million doses. You divide that by 2 because each person needs 2 doses. So we have, right off the hop, we have about 1.2 million doses. We're waiting to be advised by the federal government when the balance is going to be coming in.
So let me ask you about the lockdowns in the province's hot zones, so Toronto and Peel region, that went into effect today.
Yes.
And yet still, seeing a rising number, 1,589 cases, despite restrictions that were in place before. Let me ask you about the criticism. I mean, on the one hand, you lock it down and you get criticism there. On the other hand, weeks ago, you're criticized for not locking down soon enough.
Yeah, there's a real balance, and Beverly, I'm happy you mentioned that because you're right. A week ago, you're getting criticized for not locking down by a lot of the health professionals, which I have a great deal of respect for. Then, on the other hand, you're trying to balance the economy, but nothing's more important than health. If we don't have our health, then we don't have an economy. It goes hand in hand. And we're putting billions of dollars towards supporting small businesses to get through this 28-day period. And we're going to be supporting them every way we can, from paying their property taxes, their energy costs, with partnership with the federal government. 65% of their payroll, 90% of their rent's going to be taken care of. So we're pulling out all stops to make sure that we support these small businesses that are really struggling right now.
Well, and you've certainly heard the voices of some of these many of them, in fact, whether it's restaurant owners or retail shops, small businesses, that despite the aid, that they're very frightened they're going to go out of business. And there's all kinds of different calls this morning on the first day of the lockdowns to maybe revisit that. So one of the things we're hearing is if you can go into a big box store, but with reduced numbers going in the front door, why couldn't a mom and pop shop do the same thing and reduce the numbers? Is there any possibility that there might be a revisit to that?
Well, we're reviewing this every single week, and we're doing this for 28 days, so we'll be reviewing it constantly. And the only chance of that happening is if we see a big decline with numbers. That I'm praying every single day that we see a decline in the numbers. But again, we have to make sure that we focus on the health of the people of Ontario, and every other province should do that. Now, in saying all this, and by no means is this anything to brag about, because I'm not bragging when we have 1,500 cases. But to put it into perspective, we still have the lowest cases anywhere in North America for a region our size, especially if we look at Canada, right across everything west of Ontario and Quebec. And then you look at all the states, we're still the lowest cases, but it's not good enough. We need to continue fighting this virus and make sure that we flatten the curve, and we're doing everything we can to make sure we keep our long-term care homes safe, our schools continue to be open, and we're doing everything we can to make sure we balance that.
Well, in the city of Toronto, numbers are high, 336, but Peel, 535. And, particularly alarming in that region and maybe even the city of Brampton for the number of essential workers. And also a cry for help there saying they need more.
Yeah, well, we're really focusing on Peel. The numbers are going through the roof out in Peel region right now. We have teams out there. We have mobile testing units, and we're getting involved, deeply involved in every community that's out there, be it Mississauga or Brampton or Caledon. We're putting all resources towards Peel. But no matter what we throw, and this, I'll speak right across the country on this, no matter what government, the federal, municipal, or provincial governments throw at this, and we're throwing billions and billions of dollars, we need the cooperation of the people. Without cooperation of the people, and I can tell you, we've seen cooperation from the beginning. I can speak for Ontarians. Everyone has pitched in, but it only takes a small percentage, 1%, 2% of the people that are going out there without masks, have big family gatherings, celebrations, and that's where the spread is happening. So we need to make sure that people follow the guidelines and protocols laid out by our Chief Medical Officer.
And so let me ask you about your team, because I know you're looking to extend the term of the Chief Public Health Officer, David Williams, who from time to time has been under criticism but also very praised by you, saying such a guy of integrity. Mm-hmm. The one thing we know is it's been pretty tough on everybody, and certainly your team and the medical officers. So how did he feel about it because I know you mentioned in the news conference he could just sail off and go somewhere, not worry about it, but he's agreed to stay on. What did he tell you about staying on through this? Because it has been, as we know, very tough on him. And like other medical officers of health, he's had threats.
Well, something, I want to start off by thanking all chief medical officers right across this country. We're blessed to have some really great leaders there, including Dr. Williams. He has a massive challenge, and he's performed. I personally don't believe Dr. Williams gets a fair shake. People don't realize, and I have the utmost respect for all medical professionals, but there's one thing to sit on the sidelines looking in, and the other side is, walk a mile in someone's shoes and see the decisions that he has to make and the calls that he's up till midnight every single night. And he's a man of integrity and character, and there's no way in the middle of a war he's leaving the front. That's the easiest thing to do. But he's going to sit there and he's going to fight in the front lines with all of us until we get through this pandemic. And I'm very, very grateful for Dr. Williams' leadership. He's a true leader.
Sure. Premier, let me ask you about this as well, because we know that there's growing cases of drug use, even some signs in parts of the province, welcome signs, except they're, putting drug use on them. There is a very big mental health issue for Ontarians, yes, for Canadians in general, from coast to coast to coast. But what about for Ontario right here, right now?
Yeah, well, that's a great question. I asked that to our health team. I said, how do you measure the mental health, the depression, the abuse of drugs or alcohol when someone loses their small business that their families put everything they've had into it for 50 years? that's massive. We're putting the largest amount ever in the history of Canada into mental health and addiction. Came to office, I said, we're going to focus on this. I was very passionate to myself and our family and many families, thousands of families across the country. We're putting $3.8 billion into mental health over the next 10 years. On top of that, we're the first government of Ontario to have a dedicated minister of mental health and addiction, and he's doing a great job. But again, it was a great question. How do you measure that? It's very, very difficult. So again, there goes the balance of keeping businesses open and versus the health and safety of people. And it's really about reducing the spread. More people are out, more people out, more of a chance this virus is going to spread. And with the numbers where they are today, we just can't chance that. We have to protect the people of Ontario.
And thinking, I guess from 28 to thinking forward, 28 days from now, if the numbers are at the point at which the health table decides, okay, we can ease some of the restrictions in the hot zones, then that would be coming just before, the Christmas holidays. And wouldn't there be a concern that people will go, okay, here we go. Finally, we get together?
Yeah, good point, because that happened to us. I think it was back in September. We saw cases in a population of 14,780,000 people in Ontario. We had 100 cases. It's unheard of. And sure enough, everyone let their guard down, and we're out there, with social gatherings, and all of a sudden it just took off like an Australian bushfire. And it's as everyone knows, it's very difficult to control when it gets into certain environments, be it long-term care or other places that we have the most vulnerable people. So we need to do everything we can to shut this virus down.
Premier Doug Ford, I really appreciate you coming on the program this afternoon. Thank you very much.